My name is Whitney and I'm submitting this video as an entry for the COVID-19 competition launched by the Rural Women Center for Education and Development, Category 2. The question reads, what challenges can women/girls face if COVID-19 is not contained? Well, in past years, there have been several diseases that have affected people around the world, such as influenza and Ebola. However, none of them have led to a global shutdown like the COVID-19. The COVID-19 is an abbreviation for the coronavirus disease 2019, which is an infectious disease which began in Wuhan, China, and has since spread globally, leading to the COVID-19 pandemic. Research has it that this virus can be spread mainly from close contact and respiratory droplets produced when people cough and sneeze. Reason why the doctors and the government has asked for each and every one of us to improve on our hygiene and maintain social distancing while they look for a solution or vaccine for the virus. It is no doubt that a lot of people are going to face financial, economic, and political challenges during this period. However, today I want to focus on the challenges women and girls are going to face if the virus is not contained or contained sooner. My factors beyond that, social and economic. I'll start with the social factors. Women are going to face challenges that come from being raped or having unwanted pregnancies, poor healthcare/hygiene, and of course, illiteracy. Let me start with illiteracy. During this period, this coronavirus shut down and all, a lot of schools have been shut down. And unless you have access to online classes and very good books, a lot of people, especially young girls around the world or young girls who find themselves in rural areas, will not have access to education, hence illiteracy. Secondly, poor hygiene and lack of proper healthcare facilities. During this virus, a lot of hospitals are not as functional as they used to be. That means pregnant women or women who have been raped or women who are going through an abortion will not have the proper health care assistance that they need, which might lead to a high mortality rate amongst women. With the hygiene, not all women have the money or the finances to buy sanitary pads or stock up on sanitary pads. So you find a lot of young girls using leaves or clothes if the virus is not contained on time because they rely on foreign aid to have those materials. Last but not least, rape and unwanted pregnancy. I cannot shout this enough. This period with the lockdown and everything, and women being locked in the same compound and neighborhoods as men who don't have the access to call girls and girlfriends to satisfy their sexual urges, might be taken advantage of, might be raped, and this due to the rape they might have unwanted pregnancies. And grown women as well, being locked down and doing nothing, they might indulge in unprotected sexual activities which might lead to unwanted pregnancies. And I cannot stress enough the challenges that come with having babies that you've not planned for. Moving on to the economic challenges. If the COVID-19 is not contained, a lot of women/girls are going to be faced with financial challenges during this period, making ends meet to be very hard for a lot of women. Talk about your petty traders, talk about your farmers, talk about your entrepreneurs, your single mothers who are the sole providers of their household. Depending on the financial status of this woman, most women, especially those in rural areas or those who don't have financial assistance, are going to be faced with financial challenges buying food or buying basic household necessities. To conclude, I would say that the above factors are the various challenges that women and girls can face if the COVID-19 is not contained. However, these factors cannot be generalized. It will vary from one woman to another depending on her environment and her financial circumstances. If you are going through these challenges, or if you know anyone who is being faced with such challenges, now is a good time to help out. Now is a good time to speak up or reach out to your local police centers or reach out to organizations such as the Rural Women Center for Education and Development to help you out. As a general public, we can all practice social distancing and improve on our hygiene while the health practitioners are looking for a cure or a vaccine for the virus. Thank you very much.